In this past year, what this hospital has accomplished, what this community has accomplished, is that we went from a survival mode to a thriving situation. We're taking care of our community, we're vaccinating, and our hospital is strong. We wouldn't have accomplished what we've done without outstanding teamwork that started, quite honestly, with Dr. Steich, then moved into our local public health. Our medical staff at this community hospital has been tremendous. And then, most importantly, the employees that have taken care of these patients.
I was one of the first exposed to the COVID virus, and I was the first to have the vaccine in Harrison County. I think knowing people are wanting it and they're waiting to get it makes me feel a bit better, because nothing's going to change until we kind of get things back under control.
This morning we opened at 8 o'clock and the phone rang 10 times within the first 6 minutes. There were just 3 of us here. We're putting phone calls on hold. Every question was a vaccine question. I thought it was interesting. And as we've gone along over the last 3 months, more and more people that at the beginning indicated that they probably wouldn't be vaccinated have been calling us and saying, okay, get me on the list. I'm ready.
There's a lot of hope with the vaccines. It's been a long year in some ways, but a lot of blessings for us here, especially in Harrison County, Ground Zero. We're lucky enough in Kentucky to have a health department in every county in Kentucky, but that doesn't allow us the space to run mass vaccinations like we're doing today. So we've got such strong partnerships. This is Cynthiana Christian Church behind us. We are so super excited about the turnout. We know that at some point we'll have some vaccine hesitancy. At this point, obviously, the demand is much higher than the supply, but we're also ramping up our efforts on vaccine hesitancy and really starting to work with the community members and churches and other very trusted organizations in the community that allow us to really get in and work with them and answer questions to bring our communities along and keep us all safe.
Good afternoon. It was pretty special, a pretty special message. This last Saturday, we had a memorial marking the very first case of COVID-19 we had in the Commonwealth. That case was in Harrison County. And just to see the strength of that community, I remember vividly the county judge and head of the local health department, Mayor of Cynthiana, standing right here with me. And to go where we were from that day, from the newspaper editor, putting a free copy that talked about COVID and what to do in everybody's mailbox to where they are today. It was a miracle. I mean, we carry such grief, but there is also such hope. So let's begin today with some good news about things that are going on in the Commonwealth. Today, I'm happy to announce a great automotive-related project, the expansion of Metalsa Structural Products in Hopkinsville. Metalsa manufactures structures for internal combustion, hybrid, and battery electric vehicles, and currently employs over 600 individuals in Christian County. The company is moving ahead with substantial expansion that's expected to create 97 additional full-time jobs. The company has operated in Hopkinsville since 1989, and within 10 years of opening that location, the company added locations in Elizabethtown and Owensboro. It's a company with a great presence in Kentucky, employing over 2,800 people in our state, and I am excited to see its footprint expand even more. Metalsa has a long, successful history dating back more than 60 years. It has established itself as a global company with 20 operations worldwide, 7 of which are here in the United States. This project highlights our diverse automotive sector and how we are positioning ourselves to be a part of its future. In total, automotive-related companies employ over 100,000 individuals in Kentucky. Last year alone, despite the challenges facing the industry, we announced 31 new location or expansion projects in the industry. The announcements are expected to generate over $250 million in new investments, with the promise of over 1,000 new jobs for Kentuckians. The growth of our automotive sector has been remarkable, as has its resilience in the past months. Thank you for the continued faith of this company and its critical importance to its communities. And as we always say, feel free to expand even further. All right. Today, there's also some new good news on a number of fronts. For residents, staff, and those who visit Kentucky's skilled nursing homes and other long-term care facilities. First, I want to start by announcing that the Centers for Medicaid and Medicare Services, which oversees collection and use of civil monetary penalties, has approved a proposal by the Trilogy Foundation for nearly $6,771,000 to enhance the safety of Kentucky's residents and the public. The funds are going to be used to implement a smart entry screening platform with smart badges for all employees across 285 Kentucky Medicare certified nursing homes. Kentucky will be the first and only state to provide contactless devices and vaccine tracking that will help reduce person-to-person spread of COVID-19, the flu, or other viruses and infectious diseases. The sensors will be placed at key points of entry to safeguard the 22,450 residents living in these facilities. The long-term care autonomous screening and vaccine tracking project will continue to help Kentucky's vulnerable residents, many of whom have underlying chronic conditions, compromised immune system, and advanced age. This 2-year project is supplemented by tailored COVID-19 and other infectious disease questions to help further ensure the safest, healthiest environment for long-term care residents. The project will also assist the infection preventionist in each facility with contact tracing when necessary. The other good news, and some have waited a long time for this, is a development that is going to allow visitation at those federally regulated skilled nursing homes, that one group that we haven't been able to open up to visitation yet. Starting Monday, March 15th, these facilities that have been so severely impacted by COVID-19 will ease restrictions that have been in place for nearly a year, affecting all visitors and non-essential healthcare personnel, with the exception of end-of-life situations. Next week, visitation in these facilities can be conducted more widely. Everyone who enters the facility will be screened for signs and symptoms of COVID-19, and attention will need to be paid to hand hygiene, face covering, social distancing, and other infection prevention controls. This is great news for Kentucky and our so many families that have missed their loved ones. The light at the end of the tunnel is getting brighter, but we have to continue to remain vigilant. For more information on these changes, let's go to Adam Mather.
Thank you, Governor. Today, there's good news on multiple fronts for residents, staff, and those that visit Kentucky's Medicare certified long-term care facilities. First, I would like to start by announcing that we have completed the long-term care federal vaccination program, and all residents and staff that wanted a vaccine were able to receive one. We are already seeing the results from this effort with a large reduction in new cases. Currently, we are working with institutional pharmacies for long-term care on a maintenance program to vaccinate new residents and staff and those that may have been reluctant to get vaccinated the first time. In reference to the CMP grant, I want to personally thank the Trilogy Foundation and Todd Schmiedler for all their hard work in organizing the CMP grant for those contactless screening devices. They've been working with the team at OIG for a year to see this come to fruition. So thank you, Trilogy Foundation and Todd Schmiedler. Moving on to indoor visitation, some of the items that I will mention may seem a little redundant, but they're key points in allowing relaxation and visitation. So before I go into some of the details, I want to take a moment to acknowledge how difficult this past year has been for residents and families. In a few days, it will have been a year since residents and families have been able to see each other. We know this has taken an emotional and physical toll on residents and loved ones. So we are excited to announce that CMS, in conjunction with CDC, has released guidance for indoor visitation. And just a reminder, getting vaccinated before your visit with your loved one is the safest way you can visit them. With that being said, we are encouraging all visitors to get vaccinated. If you have not been vaccinated, we are encouraging visitors to have a negative COVID test within 72 hours of visiting. Some of the details around the new visitation guidance. One is screening all visitors. This must occur upon entry. This includes COVID-19 related questions and a temperature check. If anyone has signs or symptoms related to a potential COVID-19 infection or they have a known exposure, they should not attempt to visit. Residents that have been fully vaccinated can choose to have close contact with their visitor by wearing a well-fitted mask and performing proper hand hygiene before and after contact. And I've spoken to many family members and they just want to touch their loved one's hands. So that is great news. Accommodations for residents to have visitors in their room should be made by the facility. If they have roommates, then an alternate area needs to be designated. In the initial few weeks, we anticipate a large increase in visitation as some of these this will be the first time, the opportunity that they've had to see loved ones. We ask that you please reach out to the facility prior to visiting to ensure they can accommodate your visit. There are a couple scenarios where visits should be limited to compassionate care visits due to the high risk of potential COVID-19 transmission. Visitation should be limited to compassionate care visits if one or more of these criteria exist. Unvaccinated residents in a county with greater than 10% incident rates or red counties on the map on the KY COVID-19 website, and less than 70% of the residents in the facility are fully vaccinated. Secondly, if residents who have confirmed active COVID-19 infections. And lastly, residents that are currently in quarantine. We are certainly grateful that this day has arrived. The vulnerable nature of the long-term care population combined with the risk of congregate living in a healthcare setting have required aggressive efforts to limit exposure to the deadly pandemic. So we're excited to see this come to fruition. In addition to that, if I could get the next slide on communal dining and group activities, please. Perfect, thank you. The facilities shall ensure and utilize proper infection control prevention techniques, which include wearing a mask that's fitted properly, proper hand hygiene, and maintaining social distance of 6 feet or greater. Facilities should work towards providing multiple opportunities to participate if space is a limiting factor. And that means if you can't have everyone at dining, there should be multiple dining opportunities for the residents. And participation is not dependent on vaccination status. Residents who are quarantined or have signs or symptoms of COVID-19 or have a confirmed COVID-19 infection should not participate in any of these group activities or communal dining. If anyone needs more detailed information on this, you can find it at our CHFS OIG website, and that will be posted tomorrow. Again, I want to thank everyone for their patience through this rough time. This is great news for Kentucky. We continue to see a relaxation and improved commitment back to getting back to normal. So with that, I want to thank you and turn it back over to you, Governor.
All right, so that is good news, again, on those federally regulated skilled nursing homes. The state's requirements for visiting folks in assisted living that we talked about 2 weeks ago, I think we're at now, are still in place for those facilities. So check on what type of facility your loved one is in. I'm sure that you already know, and those will be the requirements, what the federal government sets up. We got to follow. Our state guidelines that we've set up, we believe, are the best opportunity in state-regulated facilities to keep people safe. I want to remind everybody about the Healthy at Home Eviction Relief Fund. This is a $297 million in coronavirus relief funds that came to Kentucky that offers rental assistance, 100% of past due rent dating back to April 2020, and up to 3 months of future payments. It can also help you on utility bills and prevent those utility cutoffs that people have when they don't get those bills paid. To date, we've received 7,978 tenant applications and 5,324 landlord applications. But we are nowhere near that full almost $300 million. So folks, if you owe rent, please go to the website. Landlords, if you have anybody who owes rent, please go to the website. We want to make sure that our folks come out of this with less debt, that have a brighter future, that our landlords and their businesses are compensated. And this is such a good opportunity to make sure that we can not only be healthy at home, but we can still be in a home as we come out of this pandemic. Again, the website is teenkyhherf.ky.gov. Rental assistance and funding. Okay, there's more good news as we try to keep Kentuckians in their homes. The American Rescue Plan Act that the president is signing or signed today includes renter assistance, which will be additional funding for rent and utility assistance. We hope to have greater flexibility on these funds. Homeowner assistance, funding to help struggling Kentucky homeowners get caught up on mortgage and utility payments, and help for the homeless, rent assistance and funding to create non-congregate shelters and permanent housing for homeless Kentuckians. Just note that the first checks went out on Friday, first payments from this eviction relief fund. Again, make sure you're signing up, make sure you are spreading the word. Let's help people out. All right, a little bit of UI news, and then I'm going to kick it over to Amy Cubbage. We are working right now on opening up Kentucky Career Center regional locations around the state beginning on April 15th. We believe on that date we can have 11 locations open: Bowling Green, Covington, Elizabethtown, Hazard, Hopkinsville, Louisville, Moorhead, Owensboro, Paducah, Prestonsburg, and Somerset. Lexington, we're working on space to try to make that a reality as well. Frankfort, where we previously held in-person services, are going to continue the virtual appointments. Appointments will be required when we open up these in-person locations around the state. There will be a scheduling tool we put online. Again, the date's not finalized for when that link will go up, so there's no one to call for it now. But know that we are working to get those open, and we believe we can do it safely on April 15th. For more on that and other updates, we have Amy Cubbage.
Thank you, Governor. And continuing the good news, both of the opening of the career centers and President Biden's signing of the American Rescue Plan, that obviously has good news for some of our UI claimants. That plan will continue the pandemic-related benefits that were in both the CARES Act and then the Continuing Assistance Act. Those are the pandemic unemployment assistance, the pandemic extended unemployment compensation, and the mixed earners unemployment compensation. Those are now authorized through Labor Day, September 6th. And thankfully, President Biden signed this quickly enough that we will have no gap in benefits. You might remember we had a lapse at the end of December, beginning of January, that did cause disruption for claimants. Since this was signed in time, there will be no disruption, and benefits should be continuous for those claimants. One other thing to note in the American Rescue Plan is the plan does waive federal taxes for some UI claimants. If you're a single taxpayer with an adjusted gross income of $150,000 or less, it will waive tax on the first $10,200 of benefits. If you're a married couple with an adjusted gross income of that same amount, you can, and both drew unemployment, you can both take that $10,200 for a combined $20,400. Now, if you've already filed your federal tax, you're going to have to file an amended return in order to get the benefit of that. Right now, our State Department of Revenue is examining the impact on state taxes, and we'll hopefully have more information for you soon. I want to also give you some good news about some changes, recent changes to the PUA program, the Pandemic Unemployment Assistance Program. We recently got new guidance and added 3 new circumstances that allow you to qualify for PUA benefits. One significant one is it will now allow you to get benefits for a reduction in hours. You don't have to completely lose your job. If you have just had reduced hours, you can get the difference in what you would have been making and what you are now making if that reduction is related to COVID-19. They have also made these changes retroactive. So this means if you would have qualified under the new criteria, but you were denied at any point from the beginning of the pandemic, you will get an opportunity to recertify those weeks and reapply and get those weeks paid. We are working on programming for those changes. So if you are a current PUA claimant, you will see a change in the screen that tells you for your weekly certification. Don't be disturbed by that. That's just the update. And if you are a claimant who is done, but you were denied weeks, you will be getting a notification when you can go in and attempt to recertify and possibly requalify for benefits. Now, we know we've talked a lot the last few weeks about fraud. We want to just reemphasize a few things. Please beware of fraudulent social media sites posing as the Kentucky Career Center. I'm not sure if we still have the slide from last week, but we had a slide where we were showing a fraudulent Kentucky Career Center Facebook page where they had reached out to someone across Messenger and was asking for Social Security numbers and other personal information. Don't ever give your Social Security number or personal information over social media. That is not how we contact anyone. Please block and report any accounts that follow or interact with you that ask for this type of information. And please be assured we will never charge you for services. So if someone claims to be with the Kentucky Career Center and is going to ask you for money, know that either they are lying, they're not with us, or they are doing something wrong. We will not charge you. Also, please reset your 4-digit PIN to combat fraud. Make it something that is not simple or repeating sequence. Don't make it part of your Social Security number, and make sure that it is something that is meaningful to you that you can remember, but hopefully no one else. And then one more quick note about ID Me that we discussed last week. We've had some programming constraints, so now that will not roll out till next week. But for those of you who've been having trouble getting your IDs uploaded, that is a tool that will help you greatly. There is a video chat tool. Again, if you passed ID validation and have not been asked to upload identity documents, you don't have to worry about this. But if you are stuck in an inability to get your ID documents validated, the ID Me tool will roll out next week and will be there for you to help you upload those documents and get that validation done. That's it for today.
Thank you to Amy. 1,211 new cases of COVID-19. 213 of those are in our corrections system. We'll have a report on Monday, I think from Michael Brown, about where we are in that system. But a significant number of the cases today come from corrections. Kentuckians currently hospitalized in the ICU and on ventilators, all pretty steady, down a couple or flat. Positivity rate ticked up a tiny bit, 3.95%. We like seeing that under 5%. 37 new deaths today. Some of these aren't in the last couple months. They're not a part of our audit. They've worked their way up in the normal process, but this is 37 more Kentuckians that have passed on because of this terrible virus. They include a 91-year-old woman from Ballard, a 99-year-old woman from Boyle, a 55-year-old man from Campbell, 2 women from Christian County, both ages 84, 3 men from Christian County, ages 59, 75, and 78, 2 women from Clay County, ages 78 and 85, an 86-year-old woman from Clinton County, a 97-year-old woman and a 51-year-old man from Fayette County, a 96-year-old woman from Franklin and an 87-year-old man from Franklin County, 86-year-old woman from Hardin County, 3 individuals from Jefferson County, 1 woman, 2 men, ages 82, 65, and 72, a 77-year-old woman from Johnson County, a 74-year-old woman from Kenton County, a 71-year-old woman and a 76-year-old man, both from Laurel County, a 54-year-old man from Lyon County, a 65-year-old and a 66-year-old woman, both from McCracken County, and a 78-year-old man from that county. We lost a 97-year-old man from McCreary County, a 76-year-old woman from Metcalfe, a 98-year-old woman from Oldham, 72-year-old man from Perry, a 93-year-old woman from Pike, a 90-year-old woman from Pulaski, a 74-year-old man from Shelby, a 70-year-old man from Wayne, a 79-year-old woman from Whitley, and a 70-year-old woman from Woodford. Far too many losses. Makes that bright light that we're moving towards even more important. So we will continue to vaccinate as fast as we possibly can. Long-term care setting, 9 new residents testing positive, 10 new staff, 7 new deaths attributable to long-term care settings. Let's look at vaccinations. Now let's start with Table 1. Here's some really great news. As of today, over 910,353 Kentuckians have had at least their first dose of one of these 3 highly effective vaccines. We believe we're going to hit 1 million Kentuckians vaccinated here in the next several days. That is really positive news. And we're getting faster and faster. If we look at Table 2, really just over the last 2 days, because that's how long we've had this week's allocation, we've already given the first shot of hope to 58,840 Kentuckians. And even with the increase in doses that we've received, even with that delay when we had all the snow and ice that gave us a bigger influx than we were able to vaccinate people in 1 week, and even with us only having 2 days thus far to vaccinate the current supply of 98,390 first doses for this week, of all the first doses we've received from the federal government, 91.5% are already in people's arms, and this will be getting closer and closer to 100% every week. By the end of this week, we think it's going to be much closer. Now we're going to ask Dr. Stack, who is here with me today, to come up and talk about an expansion to 1C, those that are eligible to be vaccinated, that is going to become active on Monday.
Thank you, Governor. Good afternoon, everyone. So just to summarize before you put my slide up, James, what the governor said, and just to put this in context, remember the very first approved vaccine wasn't shipped out until December 14th to arrive in the state. The second one, December 21st. In less than 3 months, we've immunized over 910,000 individuals, more than 1 in 4 adults over 16 in the state of Kentucky. It's tremendous progress in a short time, and now the pace is escalating. And as the pace escalates, things will move progressively more quickly. So I have a few slides here just to share with you to make this point. So the first one is we are going to adjust Phase 1C starting on Monday the 15th, so this coming Monday. The CDC has 2 lists of conditions that may place you at elevated risk for severe COVID disease. One list at the top are the conditions for which they have solid evidence, and they know with very high confidence that those conditions are associated with severe COVID. We've included those from the beginning of Phase 1C. There's a secondary list beneath it with conditions that might be at elevated risk for severe COVID disease. We are now expanding the medical eligibility to include both of those lists. For example, type 2 diabetes is included in the proven list, and type 1 diabetes is included in the might list. All of those conditions are now eligible for vaccination. The slide also does make the one exception. The one thing we've removed in Kentucky is smoking. So smoking is not going to be included in this, but all the other medical conditions are included starting Monday as eligibility for Phase 1C in the state of Kentucky. You'll notice this guidance, which is the guidance that I produce in my daily update meetings with the vaccine sites across the state, also includes the reminder that we are continuing to be focused on moving more than 90% of all the vaccine received in the state within 1 week of receipt. And I think that the vaccine sites have done a wonderful job with that. So thank you to them. And also, please note that the local health departments have an additional role. And so if you rely on your health department for a variety of services, please remember, in addition to attending to the general population as able, they have very specific and targeted responsibilities as well. and are going out to help vulnerable populations who otherwise might have a more difficult time getting access to the vaccine. And so please remember, the health departments have some additional focus and emphasis that they have to place on reaching vulnerable individuals. So the other sites like pharmacies or hospitals may be using their vaccine on a more expanded audience, while the health departments are being more focused. And that's doing what we've asked them to do, and I'm very grateful for their attention to that. If we could show the next slide, James. These are slides the governor has shown before. We aren't announcing any new locations this week. So we get 3 vaccines now: Moderna, Pfizer, and Johnson & Johnson. For the 5th week in a row next week, there's no increase in the Moderna vaccine, which means the locations that we would use that for, we've not been able to expand to new locations at this time. Pfizer, we have received increases. Pfizer still comes in very large minimum shipment sizes, so we've optimized the larger volume locations, and so we've distributed that across larger volume regional locations. J&J had a one-time push out last week. Nationwide, there was no shipment of J&J this week. That's what the federal government told us to expect. And next week, there'll be just a little tiny amount before it begins to expand. This map, I hope we all agree, has been tremendous progress over just a 4 or 5 week period. And James, if you could show the next slide. These are the dots that represent all the pharmacies that are supplied, including the independent pharmacies who only received a one-time J&J shipment last week. Now, when the J&J starts again, we'll start shipping again. But the reason I show this subset is the federal government has really focused on using pharmacies because there are so many of them, and they bring the vaccine closer to the people where they are. And so this is actually only a subset of all the pharmacies in the state. There are many more in addition to this. As the vaccine quantities increase, we'll continue to supply the higher volume locations as necessary, as long as they stay busy. And we will also continue to expand. And this still doesn't include the federally qualified healthcare centers, the rural health centers, your regular doctor's office, and some other settings. So we still have the opportunity to turn on more sites as we get more vaccine. And again, I show you these slides because I think it shows our attention to bringing the vaccine closer and more conveniently to you where you're located. The final thing I would say, to put this all in a context, is that at the pace we anticipate getting vaccine, we are going to move very quickly now from this point forward. That's why we were able to expand the eligibility starting next Monday to include more medical conditions. And I think as we get into April and May, it'll move very quickly. The federal government has said they anticipate shipping enough vaccine to immunize every adult in the United States of America by the end of May. That's just 2.5 months from now, folks. So we're going to make a lot of progress real quick. When it is your turn to get a shot of hope, when you are eligible, I sure do hope that you are willing to accept that. Please talk with your friends, your family, your medical providers, and make sure you're comfortable with the vaccine. This is the tool we have to bring an end to this pandemic and get back to the lives we miss. And it's something that brings great hope for me that this summer can look much more like the summers that we all miss so much. So thank you very much. And Governor, back to you.
We'll open it up to questions, starting with Stu Johnson from WEKU. Do we have Stu? All right, as we wait for him, there he is.
I'm sorry. Here I am. Appreciate your patience. Governor, on the nursing home issue, roughly how many federally regulated nursing homes are in Kentucky and how many state regulated? And then do you anticipate in the months and well, at least months ahead that there'll be some restrictions entering nursing homes, even if it be to check your temperature?
I believe, do we still have Adam on? Let's go to him to try to get the exact numbers. I believe it's 200 and something that are federally regulated that today's news will implicate. But yes, we ought to expect to have at least some things as we go into these facilities to ensure those coming in are healthy and aren't going to spread disease for at least the near future. Remember, we have wiped out the flu basically during our response to this pandemic. And while we're going to get back to more of an old normal, there are some practices that at least we could identify people who are visually sick coming into these facilities that could help protect them moving into the future. And certainly this grant that we received is going to help do that. Adam?
Thank you, Governor. Yeah, I would concur. I don't think there will be a change for a significant amount of time as far as screening goes. And to answer your question about federally certified or Medicare certified facilities, there are currently 285 facilities in the state of Kentucky. I hope that answered your question, Stu, and I'll turn it back over to you, Governor.
Okay, Melissa Patrick from Kentucky Health News.
Hi, Governor. I guess with the federal long-term care program being wrapped up, is there a final count on the percentage of residents and staff that were vaccinated? And with that 45% that was reported on February 1st for staff, that's very low. And is the state taking any responsibility to educate and provide programs to help more of them get vaccinated, or is that left up to the facility? And then, if you don't mind, I'm not real sure what that smart entry screening program does exactly. It wasn't obvious to me. Are they just checking for temperatures as people come through the door, or is it more than that?
Let's go to Adam Mather to make sure that we clarify what that program is and further response.
Sure. Thanks, Governor. So in the CARE AI tool that will be used, it is a touchless infrared thermometer that is attached to a similar device that looks like an iPad and or a tablet. And then in addition to that, it will screen the individuals with the screening questions. Those that are not staff can either go online and go ahead and pre-register, and they'll get a barcode, and they'll use that within 2 hours of entering the facility. And then staff have a attestation that they can do remotely as well. And then as they use their badge, they'll be able to key in. As far as the percentages around long-term care vaccination with that federal program, we're working with CVS and Walgreens right now, as well as the associations related to long-term care, to try and get those numbers. It's not as easy a task as possible, but anecdotally, we've seen similar numbers to the national numbers, although we did have a couple regions with Walgreens that had significantly higher numbers of 70% with staff. And I think, can you repeat your third question?
Am I still on?
Yes.
Is my volume on? Okay. Well, I guess who is doing? I just imagine that there's value in educating staff to increase that 45% number, if in fact it's still that low, to get vaccinated. Who is anyone working with them or encouraging them to get vaccinated very directly? Who should I ask again about these numbers? When should I ask again about these? When do you expect to get the numbers?
Yeah, we're still. I don't have a good answer on that. I'll get back to you on when we can expect those numbers, and we'll get those to you. And then as far as interacting, we are working with the long-term care associations, both KHCF and Leading Age. They're, I think, doing additional education with staff. The facilities and some of the larger providers in the state have reached out, and we're working with them to provide additional education and resources. And the maintenance program that we've designed allows those new employees or reluctant employees to get vaccinated, so they have that opportunity.
And as a reminder, there were 3 clinics at each of these long-term care centers. What we can track, and we'd have to compare it to totals, are how many individuals got vaccinated at those clinics. But remember, everybody working at one of those facilities can go to any vaccination center across the Commonwealth and receive their vaccine now. These clinics were also at the very beginning of the vaccination efforts, where we saw some of the most hesitancy among medical personnel, that many of which have since been vaccinated. So getting an exact number is going to be difficult given the number of options for them that they have had. We are also continuing programs about new residents who come in and new staff who come in to long-term care centers. It's tough, therefore, to get that snapshot in time. But I don't think that the hesitancy we saw, by and large, was about anything other than being worried if the vaccine was rushed, and we think it's safe and effective, and that many of those individuals who first said no have since become vaccinated. Chad Hedrick from WKYT.
Hi there, Governor. This question Dr. Stack may want to weigh in on as well. So we know the CDC says that travel guidelines aren't going to change until more people are vaccinated. But a AAA report says that summer, late fall destinations are booking up. And now we know that New York is lifting their quarantine mandate for domestic travel. So the question is, would it be realistic to say that after a year now of saying don't travel, that by some point in this summer, families will safely be able to leave the state to take a vacation, or also people could come to Kentucky and take a vacation and not have to have any quarantine requirements?
Well, certainly we believe this summer, especially when we look post-May, could be an incredibly different world, one that has so many more possibilities, including travel. Now, we hear that the CDC is continuing to work towards providing some travel guidance, especially for those that have been vaccinated. And so we're waiting on seeing that. Right now, they say no non-essential travel. But I think Dr. Fauci just said recently that he expects some new guidance to come out on that. Is that correct, Dr. Stack? Okay, and he's going to add to it and fix whatever I messed up.
So that the addition I would have here, I love traveling. I've traveled a lot throughout my career for work and for pleasure, and it's been a great joy. So I'm as eager to get back to that as anyone. The caution about predicting the future for this right now is different countries. The United States of America is very blessed. We have a great access to vaccine. A lot of other countries don't have access to vaccine like we do. Brazil is getting hammered very hard, and its variant is very dangerous. And so the worry is that if people cross international borders, that they're going to transport the most wicked forms of this virus to places, and that could undo the vaccine's benefit, or it could cause harm, serious harm, to the people who have not yet had a chance to be vaccinated. I agree with the governor entirely. I think summer and beyond could be a very different world. It may be much better for domestic travel within the United States, where a really large proportion of our country has the good fortune to be vaccinated. International travel still brings with it a variety of cautions that we need to take to heart. There are even some European countries where hesitancy is higher than in some of the other Western democracies. So we have to be very careful about the international piece. I do think that the domestic travel in the United States, if uptake for the vaccine is really good in the next few months, could look very different, and we could have nice summer vacations and fall vacations, but it's just a little too early to say that with certainty.
All right, Sarah Ladd from the Courier-Journal.
Yes, thank you. So this is regarding the new call center and those working in the 11 career centers. To what degree are those staffers going to be able to go beyond answering basic questions or fixing simple problems and tackle higher level issues? And then really quickly, could you clarify the total new cases today? Is it 2211 or 1211? Thank you.
1211. Thank you for the question. If I 1,211, 1211. Certainly in the career centers, we expect people to be able to process claims and fully address them. In the call center, it is likely to depend on the level of complexity. Let's go to Amy Cubbage as well.
Yes, the call center will be staffed with a team approach so that if the person who is on the phone cannot answer the question, they will have a buddy they can escalate to so that they can answer and take care of the caller. And the people in the career centers will be staffed the same so that if whoever you get the appointment with, if they have trouble with you, you should be able to still get your problem taken care of before you leave that appointment.
Okay, John Boyle from WFPL. Okay, John Charlton from WHAS.
Thanks, Governor. Hope you're having a good afternoon. I think a few weeks ago you talked a bit about rehiring EY. Is that still kind of on the table? Just wanted to know where we were at with that. And do we have any current numbers? Maybe Amy can weigh in on that, on unprocessed claims, how many you believe are fraudulent, that kind of thing. And I just had a question about people who filed in January and their account saying they have $0, but their claim is not under investigation. Does that mean that the claim hasn't been processed?
We'll go to Amy, and remember, it's a process. You got to request payment too, even after you're approved. Amy.
Yeah, the $0, I believe, is a glitch that they are working through for those PUA claimants. I talked earlier about the problem where the Continuing Assistance Act was not signed in time, and so all new claims had to be set up. So I believe some of that is still going on. I will confirm that for you, but those appear to be the last people who have been hung up in that system. As far as the amount of fraud, it's still a lot. We recently denied and caught 300,000 claims that we believed were fraudulent, that through some various mechanisms. Still a large percent of unprocessed claims that we have had in 2021, 50% or more at this point, are ones that have indications of fraud beyond just the failure of ID validation. So that's one of our criteria, but it's not all of it. And we are rolling out new tools every day to try to catch that and push those to the side so we can work the claims for the real hurting Kentuckians who need the assistance.
Okay, a couple written questions, and then we'll get back to reporters we have on the line. There's a question here about, are we going to offer ways to sign up for vaccines when we start them in Shawnee Park, other than online? The answer will be yes. There will be walk-up potential there, and making sure that we develop that site in ways that serve the underserved, those that have transportation issues and or a harder time getting online. Okay, on our reports, there's a question here about, on state reports, number of vaccines separated between first dose and then we say second dose, which we sometimes think about as fully vaccinated. J&J only has one dose to be fully vaccinated. That's why we really follow the first dose primarily, but there's only, I think, one line on our state report that has first dose and then second dose, but that won't always line up. They shouldn't be 1-to-1 in the end, depending on the amount of J&J there is. We may be able to break that out in the future, but again, we're so focused, rightfully so, on the first dose and how quickly we can get that to people that continues to be what we think should be the primary focus, and also how we and other states are judged. Question from WPSD in Paducah. It appears that there are a couple of regional sites that are still really working through 1B. First, what that means is that they are reaching a large part of that population, 70 and up, and others. My understanding is that 1C appointments for Lords, we believe, opened today. Baptist is going to be able to hit 1C next week in the area. And certainly as supply picks up, we think we'll see less of these variances across the state. We want people in every area to be able to get that vaccine as quickly as possible. Question on schools allowed to have prom this year. Give us a little more time, because right now so many people aren't eligible for the vaccine or to get down to that point. And prom is a big group get together that we are still being very careful about. But again, a month and a half, 2 months from now, depending on how fast these vaccines get out, we may have a very different world. Chris Otts from WDRB.
Hey, Governor, thank you for taking my questions. Two on unemployment. I'm relaying one from my colleague, Fallon Glick. She's been talking with someone who has filed 3 different times over the pandemic, got some payments initially, then the payments went into the wrong bank account. He had a phone appointment in February, didn't resolve his issue. He's made another phone appointment for April, and he's gotten notice, I think, a 1099 as to money that he did not receive. And so he's worried about being taxed on money he didn't receive. What would you say to this person? What would you do if you were in his shoes? And secondly, with the new call center and reopening the career centers, in the past, you've talked about how the Bevin administration reduced the staff at the unemployment office. And so that's been a challenge. You've also talked about bringing on new staff is challenging because you have to train them. So I'm curious how you've been able to get over those 2 issues in these announcements recently. And can you give us an idea of how many staff people there are today that can handle people's issues, and how many there will be following the new career center or the new call center and the reopened career centers?
Let's go over to Amy Covich.
Okay, with respect to the individual claimant you mentioned, obviously, it's hard to address here on the press conference an individual claimant. We're happy for you to send those to us, and we'll see what's going on. It sounds like an incredibly frustrating process for that gentleman, and we are happy to take a look at his claim. As far as the staffing for the career centers and the call center, we are hiring initially 20, and we'll eventually get up to 60 new people, and they'll be trained in phases. And as I had said before, they're going to be kind of in a buddy system so that there is a more senior person so that they can get that done. I don't have the number in front of me. There are another additional staff that are going to be hired as well, and we can also get that number for you.
And to do that, we are leveraging both federal funds, and we are asking for an increase in the budget from the state legislature. We've been working off a previously filed bill with the sponsor who is working directly with the labor cabinet. And there's some good cooperation there. Everybody in the end, once these places open, we want to do it on a schedule that's realistic, but to ultimately get help to everybody that's waited too long. All right, last question. Tom Latek, Kentucky Today.
Thank you very much, Governor. Good afternoon to you. I also have an Amy Covich question. This one is kind of an unusual letter. So friends of mine here in Frankfort received a letter as if they were an employer, specifically Madison County Schools, which were in Richmond, last I knew, not in Frankfort. And they had a claimant that they wanted them to respond to, had his name and the last 4 numbers of his social security number on there. What should they do with this letter? Should they just throw it out, send it to you all, or what would you all recommend?
Over to Amy.
I would suggest that in an abundance of caution, they should probably go to the kcc.ky.gov website and fill out the fraud form that you can get to at that button about halfway down the page. There is an option for employer, and you can click on that, and it lets you fill in. And the person can also put in there that they're not even this employer. It came to a bogus address. So there is a way for them to report that and get that in the system. But with all of those disconnects there, those letters are automatically generated by the system. There can't imagine that would ever be paid out to anyone, but it is always best if you've gotten that kind of letter to fill out the fraud form on the website, if they don't mind.
All right, everybody, let's remember we're in the middle of the fourth quarter. We haven't won this game. We haven't defeated this virus yet, which means we continue to need to use caution, wearing masks in public, doing those things that protect one another. It is so vital that over the next 2.5 months before we've had the opportunity to vaccinate all adults, that we don't, in our excitement or in our desire to get back to normal, do things that endanger people that haven't been vaccinated and put people needlessly at risk. So keep it up. Keep fighting for each other. Keep showing each other compassion. The light at the end of the tunnel is bright, but that doesn't mean you stop doing what gets you to it. So wear that mask, get that shot when it's your turn, and we will see you Monday at 4.